Hi, this is Dr. Corey Maas on Looking Your Best. I want to talk a little bit today about a common issue, and that's the lips. People come in and they talk about thin lips that they were born with, or thin lips that they developed with aging, lines around the lips, downturned corners to the lips, the ratio of the white part of the lip to the red, and that's really how the lip is structured. There's the white lip, which is the part below our nose, and then the vermilion or red lip, which is the border that we commonly think of as our lip, and the lower lip, which extends from the chin all the way up to this vermilion or red part of the lower lip. So those components, those ratios become very important in terms of aesthetics and how we look overall. When we age, one of the features is the perioral area. That area becomes quite noticeable or quite significant. In the upper face, we see sagging and wrinkles around the eyes. We'll see sallowness or depression, ptosis of the cheek area, and of course the jowls around the neckline and loss of the contour of the neck. But in all the patients and all of our just people in general, the area around the mouth becomes a significant feature in the aging process and a significant feature in general for aesthetics for both men and women. The primary treatment that's being provided everyone now is just filling the lips, and I can tell everyone that that's really only a small part of the picture. Although a significant one, and one that can add some very nice benefits, we like to look at the lip as an entire complex. When you look at a youthful lip, you'll see that a youthful lip is very commonly more diamond-shaped, so there's fullness through the mid portion of the lip. And if we look at the aging lip, in contrast, it's more elongated. When we look at a youthful lip, the ratio of the white part of the lip from the bottom of the nose down to the vermilion or red border to the red lip itself can be 1-to-1 in some cases. People like Angelina Jolie that are thought of as having full lips. 1-to-2 is nice, that's white to red lip. Once you get below 1-to-3, that means that, or in the area of a ratio of 1 part white lip to 4 parts red lip, the lip is getting quite thin, and there are a number of options for addressing that, which I'll talk about. In addition to the shape, the diamond lip that we talk about, and the ratio of the red to the white lip, we also think about the features of the white lip itself. Is it smooth skin, or do we see the little radial so-called smoker's lines there on the upper and lower lip? And so those areas are really important. And one that's often not talked about is the little roll that's right at the border of the vermilion and the white, where it just slightly slopes out. We call that the white roll. And that white roll is a very important part of definition. In fact, women accentuate it very commonly by using lip liner. So the youthful lip has those features: a nice lip roll, a nice ratio of white to red lip, 1-to-2, 1-to-1 in that ratio. 1-to-3 is still good. There are very smooth skin that we see in the upper and lower lips that approach the lip. And the texture of the vermilion or red part of the lip itself is important. The fullness of the lip is very well defined. And then some patients have a very nice philtrum, which are the two lines that extend from the nose down to the center portion of the mouth, which are the lateral or outside aspects of the so-called Cupid's bow, the little curvature that we see in the mid portion of the lip. There is a very attractive lip configuration that doesn't have a philtrum, where we have lateral lobules. And there's a number of actresses over the years that have had that lips that we would recognize that have a absence of a philtrum, but a nice full lateral lobule to the lip. Either of those can be attractive. Most of us have a philtral configuration with a Cupid's bow. In contrast with the aging lip, or lips that are thin, and this can happen in younger people, we see a ratio of white to red lip that is extended beyond 1-to-4. It can be 1-to-5. In some patients that I've seen, it's really just a very small border or line of red lip that we see when speaking, or even in repose when we're relaxing. There are corners of the mouth that begin to turn down. The effect of jowling as the tissues sink here in the cheek gives the downturned lip, and it's somewhat impacted by the action of the depressor anguli oris, a muscle that is inserted at the corner of our mouth and actually pulls it down. As we age, that gets more powerful and creates a downward force that pulls the lip down, forcing us into an expression that makes us look angry or frustrated. And so we can correct those in a couple of fashions, which we'll talk about later. again, getting back to the key feature, which I think people focus on primarily, volume. Volume is a very relatively simple process that can be done in the office. There are a number of different injectable fillers, the HA fillers primarily, that I think are safe, effective, and most importantly adjustable so that we can get it just perfect. And in the end, we'd like everybody to have a natural, youthful lip that imparts vigor and happiness, and not a sour or dour expression to our faces, whether it's age-related or whether it's something that you were born with. So in summary, what we're looking for is the ideal configuration to the perioral, or around the mouth area, including the lips. We'd like to see nice contour and shape to the lower lip that are devoid of deep lines or a downward turn or a dour expression, and that imparts the impression of being vigorous and happy and youthful, something that we want at any age. The options that we have surgically or non-surgically include the fillers that I mentioned earlier. There's a lip lift that we can do. There's a couple of approaches to that, and I'll get into that in more detail later. There's a corner of the mouth lip if it's a severe downturn. Of course, we like the idea of making sure that there's no radial lines, that the skin of the white part of the lip is nice and smooth. And all of those procedures or approaches to the lip are beneficial in trying to get closer to the perfect lip for you. As always, I welcome any questions that you have, and I very much appreciate your watching and listening. This is Dr. Corey Maas on Looking Your Best.